I'm joined now by Dr. David Kirk, Associate Chief Medical Officer for WakeMed Health System. Dr. Kirk, thanks for being here today.
Absolutely. Happy to do it.
So WakeMed has been offering these treatments since November. How exactly do they work?
Yeah, so WakeMed started in November. We've given about 1,000 doses since then. Monoclonal antibodies are a Y-shaped protein that attaches to the outside of the virus. It directly gums up the virus so it can't attack the cells. It also encourages the immune system to attack the virus and completely clear it from the body. It's used in high-risk patients only, typically those obese, 65 and older, patients who have very high risk of, if the infection completely overwhelms the system, getting into the hospital, getting to our ICUs, and having bad outcomes. So it's been a really wonderful weapon to have in that high-risk population.
How much of a game changer have these types of treatments been in preventing complications from the virus?
Yeah, so early in the days, us as ICU physicians, for example, had great tools. We had remdesivir, we had steroids, but really my outpatient colleagues didn't have much for people who had early infections. I mean, what do we do when someone comes to your clinic and says, I know I'm high risk, but I have an early infection? And that's what the monoclonal antibodies have really provided. It gives us a tool in those very early days to put out the fire before it completely burns the house down. It's been a wonderful weapon in that high-risk patient population to keep them out of the ICU and keep them from having those really bad outcomes.
And we're seeing, fortunately, less and less of those bad outcomes. How much of that is because of these treatments?
So really the reason our case numbers are down is from the vaccine. And I continue to encourage everybody to get the vaccine. That's our really best weapon. But what the monoclonal antibodies have done is really those high-risk patient populations is given us a way to treat them before it gets so much worse. Our very elderly, obese patients with chronic medical conditions, it really gives us a way to save them before they kind of go down this very damaging COVID cascade.
And these treatments are still being studied. What still needs to be figured out to make these treatments even more effective?
Yeah, that's a great question. So these monoclonal antibodies are based around the virus that's in the community at the time. So the first generation of monoclonal antibodies came out in November. So they're really built to treat that virus profile. That being said, we know with the mutations that the virus continues to evolve. So we will continue to see newer and newer generations of monoclonal antibodies come out to tackle these mutations. WakeMed is switching over to the second generation of monoclonal antibody products now, as many other hospitals are as they become available. And it'll continue to be a battle. The virus will change and these monoclonal antibodies will change with it.
And speaking of that, what do you envision the future of treating COVID-19 will look like? Will it soon be like the flu where someone's given an oral medication like Tamiflu?
I think it's a great question. And before I talk about treatment, I just want to stress the importance of prevention. Keeping the fire from burning the house down is so much easier if you never start the fire. And vaccine and social distancing and masking is really what prevents that fire from starting. Treatment of COVID is really in two phases. It's one when that virus is replicating in your body in the first 10 days. Remdesivir and monoclonal antibodies are IV infusions that stop that virus from replicating in the system. It's not a pill, it's an infusion, so you either need to be in the hospital or come to a specialized clinic to be able to get that. And then the second phase is after the virus has kind of burned itself out in your system, is all the inflammatory cascade and all the downstream damage it does. And that second phase is the steroids and immunosuppressive agents that we do. I think we'll continue to see advancements because we have never seen the medical community come together on a worldwide basis so much as we've done with COVID. I mean, for a vaccine to be so effective and to be available so quickly in this disease process is really incredible. And I'm really hopeful that we will continue to find preventive agents, early treatment agents, and late treatment phases as the medical community continues to attack this.
Dr. Kirk, thank you for your time. Appreciate you being here today.
Absolutely. My pleasure.